Hey there, everyone. My name is Kelsey. I'm a team member with Sarah Michelle NCLEX Review. And today in this video, we will be talking all about Naegele's rule. Do you remember what that is? Naegele's rule is a pregnancy dating tool we use to determine an infant's expected date of delivery based on a client's last menstrual cycle. Naegele's rule is used in all different aspects of nursing. You will not only see this used in labor and delivery, but you may also see it used if you work in the emergency department or even in an outpatient center. Naegele's rule is named after a German obstetrician, Franz Naegele, who came up with this estimation for a delivery day in the early 19th century. What is a typical gestation period? A typical gestation period is 280 days or 40 weeks, which is how we get the estimated due date from this tool. So how do we calculate this? Well, the first thing we need to determine is the first day of the client's last menstrual cycle. From there, we add 1 year, subtract 3 months, and then add 7 days. I do want to point out that this is based on an average ovulation cycle of 28 days and conception on day 14. So this rule does have some limitations. Do you know what those might be? Some clients may have a shorter or longer cycle. Conception may not have occurred on day 14, and some clients might not even remember when their last cycle was. The most accurate way to determine a due date will always be through ultrasound measurement of the fetus, where the sonographer will measure the crown to rump length. Okay, let's look at a couple examples to break this down. Let's say we have a client who presents for her first prenatal visit. She states she believes she is around 8 weeks pregnant. She tells you that her last period was on February 5th, 2023. She then asks you when her baby's due date is. What do you think? Well, first we are going to add 1 year, so now we are on February 5th, 2024. Next, we need to subtract 3 months, which gives us November 5th, 2023. And then finally, we add those 7 days, leaving us with November 12th, 2023 as her due date. Not too bad, right? Okay, let's do another one with a little practice question here. During a prenatal visit, a client tells the registered nurse that their last menstrual period was November 25th, 2022. Based on Naegele's rule, when is the estimated due date? And if you need to pause this video, go ahead and do so. All right, everyone, the answer is B, September 1st, 2023. And how did we get that? Well, remember, first we need to add 1 year, so that takes us to November 25th, 2023. Next, we subtract 3 months, taking us to August 25th, 2023. Then we add those 7 days, getting us our answer of September 1st, 2023. Notice how in our other answer choices, we had a couple of trick dates that could have stumped us if we forgot one of those steps of Naegele's rule. That's why it's so important to remember all 3 of those steps to calculate an accurate due date. And why is it so important to know an accurate due date? Well, we do a lot of testing throughout pregnancy, and it's important to do those at the right time. For example, we perform a gestational diabetes screening between 24 and 28 weeks. Testing during pregnancy allows us to make sure the fetus and the client are being treated for any potential complications. We also want to make sure that the fetus is growing at the right rate, and we need accurate dates in order to take those measurements. Okay, speaking of measurements, you know we love a bonus question, so let's dive into one here. Where would the registered nurse expect to palpate the fundus in a client who is 12 weeks pregnant? And if you need to pause the video, go ahead and do so. Okay, if you answered B, you got it. Let's break this down. First, what is a fundus? A fundus is the top part of the uterus. So at 12 weeks, we would expect to see the top of the uterus, the fundus, at the symphysis pubis. Around 15 weeks, give or take 1 or 2 weeks, we would expect to see the fundus midway between the umbilicus and the symphysis pubis. At 20 weeks, we would expect that fundus to be at the umbilicus or right at that belly button. And then finally, at full term, around 40 weeks, we would expect the fundus to be right around the xiphoid process. I want to wrap up here by telling you a little trick here about Naegele's rule. So you have to remember to add a year, and then you subtract 3 months, and that makes sense when you think about a pregnancy being 9 months, right? We added a whole year, but a pregnancy is only 9 months, so we need to subtract 3 months. Then I want you to remember that Naegele has 7 letters to help you remember that you need to add those 7 days. And that's a wrap on Naegele's rule. You are one step closer to becoming a real deal registered nurse. Thanks for joining me today, and we hope to see you back here with another content video. Be sure to hit subscribe so you don't miss our newest videos. Happy studying!